Monitoring blood pressure at home. Thank you for joining our Monitoring Blood Pressure at Home webinar. We are recording this meeting, and so if it popped up on your screen, you might need to click continue to stay part of this webinar moving forward. So a couple of housekeeping items before we jump in. It is being recorded, as I mentioned, so that we can share it with others who are unable to attend today. And all of the lines are muted for you, so you're unable to speak out loud during the conference, but we still want to hear from you if you have questions. There's a Q&A button on your computer or your Zoom app, and anytime during the webinar, feel free to type in questions that you have for our panelists. And at the end, we will answer as many of the questions as we can. And if by chance we can't get to them all, we'll make sure and send it in a follow-up email after the call. We'll also be sending you some of the other resources and links, so you don't have to hurry to take notes during the webinar. Okay, so let's go ahead and dive in for the day. So I'm Cherish Hart, and I'm the Vice President of Health Strategies for the American Heart Association in the Puget Sound region. And I'll be your moderator today with panelists from the American Heart Association and the Washington State Department of Health. Many of the more than 100 million American adults that have high blood pressure don't even know that they have it. And that's because often there are no symptoms. Now, once diagnosed, high blood pressure can't be cured, but it can be controlled. To do that requires daily attention, and a simple blood pressure check is the first step to preventing damage. Checking your blood pressure at home can actually be really helpful because you're able to get a sense of what your blood pressure is when you're calm, rested, and relaxed. And for many of us, our home is the place that we feel most comfortable. So that's the silver lining of the stay home, stay healthy measure, is you're in that comfortable environment. Now, when you're at home, you can also control when you measure your blood pressure and what you do beforehand to get an accurate measurement. Blood pressure is a very sensitive measure, which means that you can see changes very quickly. It might even react depending on how much salt you had in your food that day or whether or not you went out and did some exercise. Now, our heart pumps blood through your body, providing oxygen to every cell. And that impacts everything from your brain to your toes and everything in between. When you check your blood pressure at home and you share this information with your healthcare provider, you and your provider can make decisions about treatment for your high blood pressure, and you have the best information available. This way, you can be really sure that what you are doing each day is getting your blood pressure where it needs to be to best prevent heart attacks, strokes, and other serious health problems. This can help provide information about the effects of any medications you are taking to address your high blood pressure, so your healthcare provider or your pharmacist can make needed adjustments. So before we dive into learning more how to do this, I'd like to introduce a longtime American Heart Association volunteer, Laurie Manning, to share her story of how watching her blood pressure at home after her stroke helped alert her to an issue. Laurie?
Oh, technical difficulty. Hi, I'm Laurie Manning. Thank you, Cherish. I was just going to say, I mean, based on our current conditions right now with the stay home, stay healthy, I think it's really important to monitor our blood pressure, especially there's a lot of added stress if we're staying at home. One of the reasons why I really monitor my blood pressure is I do have a medical history. I had a stroke and I had cancer back in 2003 when I had considered having another baby. Talked with my doctor. got all the tests taken. Everything looked good. He gave me the green light. But his one concern was about my high blood pressure medication. So what he said is I needed to not take that during the pregnancy and monitor my blood pressure on a daily basis. So as that all started, everything was great. Fabulous pregnancy. Everything was wonderful. I delivered and they sent me home a day after giving birth to my daughter. And I was at home and just starting breastfeeding. I knew that was a great thing for the baby. And I remember having some chest pains. And I thought, wow, this is going to be hard doing this breastfeeding thing. Maybe, I just got to get over the hump, as people kind of talk about that. Anyways, it was my third day and I had just let the dog out downstairs and I was walking back up the stairs and all of a sudden I was like so out of breath. And it really occurred to me, well, maybe I need to take my blood pressure now. I mean, I thought I was kind of in the clear. So I went and I got my blood pressure monitor, put it on. I took my blood pressure and it was 170 over 114. And I was just shocked. So called my doctor right away. They sent me to the emergency room. And that was 3 days later. And so I'm there and I had heart failure, and they actually call it peripartum cardiomyopathy. I'm going to say that right. Anyway, so I guess the point for me is, one, having that medical history like I have, going in to have a baby, I monitored on the daily basis, and I just continue to do that after that. So I just think it's very, very important. And I feel that, checking your blood pressure is so necessary, even if you're high risk or not, because detection is the key to early recovery. So anyways, that's my story. And thank you for letting me share that, Cherish.
Thanks, Laurie. Well, we're certainly glad that you were checking it and that you're still with us and healthy today. Now, let's get into the nuts and bolts of how to take your blood pressure correctly so that you get the most accurate results and you and your healthcare provider can trust the information. I'd like to introduce Sarah Eve Sarlicker. She's the cardiovascular consultant at the Washington State Department of Health, and she'll walk us through that. Sarah Eve.
Hi. Thank you, Cherish. So good afternoon, everyone. Thank you for joining today so I can demonstrate how to accurately check your blood pressure at home using an automated monitor. So here are a few tips to know before you start. You don't need an expensive machine, but you do need one that you can use on your upper arm, not your wrist. Unless your healthcare provider tells you otherwise, an upper arm monitor is going to give you the most accurate reading. And you also want to choose an upper arm cuff that's the right size for your arm. Most machines will fit most adults, but some people might need a larger or a smaller cuff. And the box can tell you the cuff size, for example, what this box looks like. And it says right on here what the cuff size is, that it fits arms 9 to 17 inches. But I have an example of another machine that fits for larger people. There are machines that are specifically designed to get accurate readings like this one. I can show you. It looks like this, and the cuff has a larger cuff that looks like this. If you don't have the right size cuff, then the readings won't be accurate. So what do you need to do before you measure your blood pressure? We're going to show this checklist here. So first, caffeine. No coffee or highly caffeinated beverages such as energy drinks within 30 minutes of checking your blood pressure. If you've had caffeine, wait or try to schedule a time to take your blood pressure before you've had any. Caffeine temporarily raises blood pressure and can give you an inaccurate high reading. Tobacco or nicotine. If you're using a product containing nicotine, such as cigarettes or vapor products, the recommendation is to quit. But if you do use these products, wait 30 minutes after using it before measuring your blood pressure. Smoking, vaping, and using other forms of tobacco or products containing nicotine can raise your blood pressure and won't give you an accurate picture of what your normal blood pressure is. So if you're concerned about the impact of smoking or vaping on your blood pressure, this is a great reason to get help with quitting. So you want to measure your blood pressure at least 2 hours after exercise or a large meal. So if you've just taken a short walk or had a snack, it's okay to rest for about 5 minutes and then take your blood pressure so you can get an accurate reading. But if it's a big session of exercise or a meal, then you're going to want to wait at least 2 hours. Go ahead and use the restroom. Surprisingly for most people, they don't think about this, but emptying your bladder first is very important because a full bladder can lead to a falsely high reading. And also wash your hands. So be sure to wash your hands before and after using the blood pressure monitor, especially if you share it with other people in your house. You can wipe the parts of the monitor that are touched by your hands and your or your skin, such as the display or the cuff itself, and you can wipe that down with a sanitizing wipe before and after using it. Okay, so you haven't had caffeine or tobacco in the last 30 minutes, and you haven't had a large meal, and you haven't exercised in the last 2 hours, and you just used the restroom and washed your hands, so what should you do next? So you're going to want to prepare. You need a chair with back supports. This chair is pretty good, but I added a pillow, a tall pillow, so that I could get my back supported while still having my feet flat on the floor. You want a table or a surface so you can comfortably rest your arm for taking the blood pressure. And then you want to have something to record it with. Some people might use their smartphone, and some people might use a tracker like this one. So these trackers are available from the Washington State Department of Health in a variety of languages. This one's in English. And here's where I write down my blood pressure readings. So I've got my tracker and a pen ready so that I can write it down immediately. So once you're in the right position, you want to take a 5-minute period of rest before starting the reading. You want to sit comfortably in your chair with your feet flat on the floor, not crossed, and with your back supported. So you could put a step stool under your feet, and like I've done, you could make sure your back is supported with a tall pillow so you can sit far enough forward. And so here's this graphic of what this looks like. And it's surprising to people how much each of these different things can have an impact on contributing to an accurate or inaccurate reading. Okay, so now you're ready to check your blood pressure. So we're going to see that in real life here. You want to place the cuff directly on your bare skin. So if you have clothes on that are in the way, it's best to have your bare skin available. But if you have a thin layer of clothing, if modesty is a concern, that is okay, but a bare arm is best. And if you're sharing your blood pressure monitor and cuff with others, you can clean off the cuff between uses with an alcohol or disinfecting wipe. So you want to place the cuff on your upper arm. I'm going to show you, sorry, get the Velcro sound in there. At the bottom, at this one, there's this little black dot, I hope you can see, and that I'm going to try to align with the artery on the inside of my arm. So just align with the inside of my arm. And I'm going to place it, and I'm going to try to have a little bit of space, about at least a ½ inch between the bottom edge of the cuff and the elbow. So there's a little bit of room right there. And I'm going to go ahead and put this on. And then I'm going to make sure that this air tube is facing down and that this is aligned with the inner part of my arm. Just going to make it a little bit tighter there. Okay. And then I'm going to rest my arm on the table so that it's about, my upper arm is about aligned with where my heart is. So I don't want it up on a surface that's too high, and I don't want it dangling down too low. So you can use either arm. If you check both arms and there's a difference in the blood pressure reading between the arms, please make a note of that and let your healthcare provider know. But you should use the arm that has the higher blood pressure reading in that case. Okay, so next, okay, so you supported your arm. You want to be relaxed. You want to relax your body and stay in a seated position. And avoid talking or being talked to while you're taking a measurement. And we're going to shift, and Cherish is going to talk for a bit so I can do that while I'm quietly taking the measurement. And then don't use screens or watch television if you can. You want to just be relaxed and calm. And then you're just going to press the start button on the monitor. And the cuff's going to inflate and feel tight for about a minute. And then it'll relax and display the reading. So over to you, Cherish.
Well, thanks, Sarah Eve. So it should only take a minute for her reading, but I wanted to cover some important information about what the numbers mean. And so you can see, for those of you online, you see a chart here that gives some idea of the different categories of blood pressure. In general, for most people, a blood pressure that is less than 120 systolic, that's your top number of your blood pressure, and less than 80 diastolic, that bottom number, is considered healthy. This chart shows blood pressure categories, and if it's higher than 130 over 80, it's important to have your healthcare provider tell you what the next step should be for you. If you have high blood pressure, ask your healthcare provider what is the range that he or she wants you to be in and what to do if you're not in that range. Now, if you take your blood pressure and you get a single high reading, it's not an immediate cause for alarm. If you get a reading that's slightly or moderately higher than normal, take your blood pressure a few more times with 5 minutes rest in between, and consult your healthcare professional to verify if there's a health concern or if there may be issues with your monitor or other things going on. Now, on the other hand, if your blood pressure readings suddenly exceed 180 over 120, so down in that red zone, wait 5 minutes and test again. If your readings are still unusually high, contact your doctor immediately. You could be experiencing a hypertensive crisis. Now, if your blood pressure is higher than 180 over 120 and you're experiencing signs of possible organ damage that could be signs of a heart attack or stroke, now here's where you don't wait. And if you're not going to wait for your blood pressure to come down, this is time to call 911. Now, I want to review with you what those signs and symptoms of a heart attack or a stroke are, because it's extremely important, if you have any of these, to call 911 right away. You know, even though we're having a pandemic, hospitals and first responders are trained to help you safely and quickly despite that. So with a heart attack, you can see on the screen here that the primary symptom is chest discomfort in the center of the chest that lasts for more than a few minutes. Now, it may go away and come back, and it could feel like uncomfortable pressure or squeezing, like someone's kind of sitting on your chest. That's the most common symptom, but many people have other symptoms altogether, especially women. Things like discomfort in other areas of the upper body that's unexplained, pain in one or both arms, back, neck, jaw, or stomach. Also, if you have shortness of breath with or without chest discomfort, that could be a sign of a heart attack. Even breaking out in a cold sweat, nausea, or feeling lightheaded. So if any of these things are happening and seem unusual, that's an important reason to call 911 and they can assess you. Now, another emergency that you want to keep know the signs for is stroke. The signs and symptoms of a stroke has an easy acronym, luckily, which is FAST. And that stands for, F is for face drooping. So if one side of your face is drooping or is numb, then that's a sign that you may be having a stroke. A stands for arm weakness. So if you try to lift both arms and one is weak or numb or drifting downwards, that may be a sign of a stroke as well. S stands for speech. So if your speech is slurred or unable to speak properly, or the words come out jumbled in a simple sentence, then that's another important sign to watch for. And all of those, the T stands for time to call 911. So if any of those signs are occurring, or those heart attack signs we talked about before, calling 911 immediately is that best chance for surviving from a heart attack or stroke. And even during a pandemic, it's safe to go to a hospital and needed to go to a hospital for those things. All right, let's go back and check on Sarah Eve's reading and see how she's doing, and we'll go from there. Sarah Eve.
Okay, so yes, I got my reading while you were talking, and this is what it said on the display, if everyone can see that. So that 113, that's in that healthy range or normal range for systolic, and the diastolic reading, that 83, is a little bit elevated. So I'm definitely going to make note of that and talk to my doctor about it when I see her next, talk with her through telehealth appointment next. Okay, and then I went ahead and wrote that down on here, and now I can go ahead and press stop on the display. So sometimes your provider might want you to take your blood pressure again. In this case, wait 1 minute between readings and make a note of both readings. So thank you so much for letting me demonstrate this, and I'm going to turn things over to Elaine.
Thank you, Sarah. Hi, my name is Elaine Kittamura. I'm the Community Impact Director of the American Heart Association in Puget Sound. Here are some few options on how you can keep track of your blood pressure. And don't worry, because we'll be sending a follow-up email to you with links to some of these resources. So the simplest method is, of course, the good old pen and paper. You can also dedicate a small notebook to tracking, or use a simple tracking form like this one that we're going to show on the screen. And we'll be sending a link to everyone on the call so you can download and print this. But wait, there's more. We also, American Heart Association has a free online tracker at www.ccctracker.com/AHA. This tool will allow you to set up an account. You can keep track of your numbers in a secure account, and you can see your trends over time. You can simply click on create an account, and you will use code 7 for our region. Some advantages of this is that you will have a record that you can share with your healthcare provider, and you can receive reminders from the system. In addition, AHA will be able to share some regular health education information with you if you enable the system. Thank you for spending time learning from me today. I'm going to hand it back to Cherish.
Thank you, Elaine. I appreciate that. So now we have time for some questions and answers. And so if you have any questions that haven't been answered yet, you can type them in the Q&A. And we'll start going through those, as many of them as we can. And for these questions, we also have with us, I'm going to welcome to the panel Dr. Cheryl Farmer from the Heart Disease and Stroke Prevention Program at Washington State Department of Health. I may be sending some of the questions to her as well. In fact, the very first one I'm going to send to Dr. Farmer, and that is, how can I improve my blood pressure?
Well, hello. Thank you, Cherish, so much for having me here. And that is a great question. So there are several things that you can do to improve your blood pressure. It is, however, always important and a good idea to check with your healthcare provider before making any significant changes. Eating more fruits and vegetables, increasing physical activity such as yoga, walking, stretching, even dancing are great opportunities, great ways to increase physical activity. If you smoke, quit. Limit alcohol to 1 drink per day if you are a woman, and up to 2 drinks a day if you are a man. Eat foods low in sodium, reduce stress, maintain a healthy weight, and limit caffeine. Thank you.
Thanks, Dr. Farmer. That's great. See, I have a question for Sarah Eve around how often should I check my blood pressure?
Thank you, Cherish. So you want to ask your health care provider when and how often they want you to be checking your blood pressure. So it can be helpful to have 2 sets of readings a day for 5 to 7 days in a row, 1 set in the morning and 1 in the evening. So if you drink coffee, for example, in the morning, you're going to want to take your blood pressure before you have coffee and after you've used the bathroom. Your provider may want you to take it once, wait 1 minute, and then take it again. And then in the evening, you may want to check your blood pressure before dinner or wait 2 hours after dinner, while also following all of the other recommendations. And Cherish, I do see we have a question in the chat. Would you like me to answer this one?
Yeah, go ahead.
Okay, so what the question is, a question came in of which, oh, sorry, this was in the Q&A, not in the chat. There's a question in the chat that would be good for Dr. Farmer if she's available to answer. But which brand the blood pressure apparatus can I buy to keep at home? So there are multiple brands, and Mary answered this question already in writing, but just wanted to let you know that if you look online, so both American Heart Association is coming out very soon with some guidelines that you can use, but you can also Google Hypertension Canada, and they have a list that tells you which devices have been studied to prove that they are accurate. And a really good practice is to check with your healthcare provider and bring it with you so the healthcare provider can look at the blood pressure on the device and also what they measure in the office and make sure that it is accurate.
Thanks, Sarah Eve. Dr. Farmer, there's a question asked, can certain foods immediately raise your blood pressure?
That's a great question. It really depends, and for some individuals, maybe what medications they're already on, what their current medical history is. So that may have the potential of having an impact. Like when you think about drinking caffeine and recognizing the effects that caffeine can have, eating foods that are increasingly spicy or hot can also cause an effect in one's body. So again, it's really important to talk with your healthcare provider about foods, the diet that you would be best for you. And a number of times the doctor will connect you with a dietitian or nutritionist to help you with answering those questions.
Dr. Farmer, I thought maybe I'd stay with you. You talked about lifestyle changes. You know, if someone wants to know how soon would you see results after a lifestyle change?
Well, that's another great question. Lifestyle changes vary. So there are a number of different things that one can implement when you're talking about lifestyle changes. So lifestyle changes include changing your diet, include increasing physical activity, includes opportunities for meditation, stress reduction, relaxing. So all of those have an impact on your blood pressure, even getting more sleep, because sometimes we don't realize that our days are so long and we're so engaged. And even now during this time when we are at home, we may find that we're working longer hours because it's more convenient for us to be behind our computers or in our offices, spaces within our homes and working. And so we may be getting less sleep and spending more time in front of a screen. So depending upon the activities that you're engaging in, those can all have different effects or aspects to how you see the changes or what changes you see in your blood pressure. Again, this would be a great opportunity to really reach out to your healthcare provider and ask him or her what are some of the suggestions that they would have for you in the plan that you are working on with your healthcare team to really improve your blood pressure and monitor those numbers. But I think that's a great question.
Thank you so much. Let's see, Sarah Eve, do you want to ask a question or answer this question about, is there a method to check your blood pressure without an automated monitor?
So you, there's, if for checking your own blood pressure, an automated device is probably your best bet. Some people do master the ability to use an inflatable cuff and a sphygmomonitor. That is a bit of a challenge. Some people can do it really well, but it is hard to do that for yourself. So if somebody else is measuring it, they can use a non-automated device. But it would be interesting to know what reason somebody wouldn't want to use an automated device. So if you have some reason for not wanting to use one, that's a great thing to talk about with your healthcare provider to see what other options there are. There may be some place in the community where you could get your blood pressure checked, such as a fire station. You know, right now that's a little challenging, but it would be good to explore with your healthcare provider what is it about the automated monitor that makes you uncomfortable or you might not be able to use.
Yeah, and sometimes it may be issues of cost and accessibility as well. So, you know, a lot of times it's not covered by health insurance, but it is good to talk to your health insurance carrier. Call the number on the card to see if you have high blood pressure, if they will cover it, or if you may have an option to use an HSA, that's your health savings account, for purchasing one as well. I do see that we are at time. We have just a couple of other questions but I will make sure and answer those in our follow-up message that we send to all of the attendees moving forward. So we'll make sure and save those. But I did want to just thank you all for attending today, and especially thank our panelists and the Washington State Department of Health for their partnership and working together. And to let you know that you're also welcome to contact us through the information on this slide. There's a general email box that we can triage to any of our panelists, and that's puget.sound@heart.org. And know that we'll also be sending you some really helpful follow-up links later this week, including information on the validated device list that will be posted on Wednesday as well. So from our heart to yours, we wish you to take best care, stay safe, stay healthy, and take care moving forward. Thank you so much.